We have more now on our breaking news out of Farmington this noon. There are reports of an Ebola situation at the Uconn Medical Center. A news conference just wrapped up. Our own Mark Davis was there, and he tells us a patient was admitted last night. That man had a fever and muscle aches. Those symptoms are similar to those of Ebola, so doctors cannot rule it out. That man returned to the U.S. from Liberia back on April 30th. He was working with a group to work on Ebola and cures as an administrator, but he did not have any direct contact with patients. Doctors say he is at a very low risk. We'll have much more on this developing story throughout this day here on News 8 at noon. All right, we're now going to go to News 8 medical reporter Jocelyn Mementa, who is live at the Uconn Health Center right now. Jocelyn, are you there?
Keith, I just got off just left the news conference headed by Dr. Paul Skolnick, Chair of Medicine here at Uconn Health. He says they are testing the patient as a precautionary measure. The patient walked in last night about 7:17. He presented with symptoms a day or two ago with fever and muscle aches. And they really feel that this is just a precautionary measure. He returned from Liberia just a few days ago. April 30th, I believe, is the date. He was an aid worker and on some type of administrative role at the time. He had no direct patient care. We were told he walked in ambulatory last night, but sources tell me he was dropped off by family members, but those family members have been cleared by state DPH, and they have not been quarantined at all. As you recall, just a few days ago, Liberia was declared Ebola-free. We're told the patient is well and is stable, and they do expect to have the test results back within 24 hours. But as you also may recall from the case at Yale New Haven Hospital, the test results came back fairly quickly later in the afternoon, so possibly we may get it later today. But Dr. Skolnick says to expect it within the next 24 hours. Back to you, Keith.
Jocelyn, thank you. And we, of course, will continue to follow that story throughout this day.